Good afternoon or evening. We're here today with three of the participants in the IZA's conference on environment and health, which just finished up about 20 minutes ago. And what I'd like to do is talk with three of them about their papers, which seem to me at least to be among the more interesting ones that were presented at the conference. So let me go in turn, introduce them first of all. First, we have Ben Elsner, who I believe is at University College Dublin.
Right.
Cristobal Ruiz-Tagle, who is at the LSE, I believe,
Yes, that's correct.
and Claudia Persico, who's at American University in Washington, D.C. Again, as I said, these are among the more interesting papers I found anyway. Maybe my tastes are different. Anyway, let me start by asking Ben a question. The paper you wrote shows that unusual amounts of air pollution hurt the vote share of incumbent parties in Germany. My question is why?
Why? Okay. One of the reasons is that we know from other research, air pollution, high levels of air pollution puts people in a bad mood. And that seems to be the main reason behind why people then get angry with the current government and vote against it.
Okay, that's fine. But in Germany, you don't vote for a government, you vote for the candidates of the government slate, like the CDU or the Social Democrats. Would the same thing happen in a presidential system, like the United States, for example, or Cristobal's home country of Chile?
So I couldn't say overly much about Chile because I'm not overly familiar with it. In the United States, in the presidential elections, it would probably be harder to find such an effect. The reason being that what we were looking at was the voting for particular parties, of which there are quite many in Germany, whereas in a presidential race in the US, there are typically only two. So therefore, you have a lot of parties in Germany in the center, and whether you vote for one or the other, there is a lot of voters who vote for different parties in different elections. So that people then change their mind is not exactly uncommon, whereas I guess voter preferences in a two-party system are much more entrenched, and therefore we should expect fewer people changing their mind in response to high air pollution.
Now, again, another reason the German system is strange, I mean, it has some kind of proportional representation, as I remember, their districts and PR. What about in the UK system, which has this first past the post system? You get a plurality, whatever it is, you win. What do you think would happen there? Again, I realize it's a speculative question.
I believe it would be similar to the US. It's also a system that largely has two parties, at least nowadays, that are dominant, and so you have very strong strongholds for that vote always conservative or always Labour, and very few people who are undecided, and that's what you basically need in order to find these type of effects we find. So the comparison would rather be France or Italy or Spain, so countries that have quite diverse representational party systems.
Netherlands too, presumably, which is very fragmented party-wise. Wouldn't that be a good example also?
Sorry?
Netherlands also would
Netherlands,
be a good
yes, absolutely.
perfect example. Okay,
Yeah.
very good. It's a neat study. I just worry about how applicable it really is, and I think you've delineated that. Let me move on and talk to Claudia Persico about paper which reasons I trust she understands, find very interesting. Namely, she shows that unusual amounts of air pollution increase the suicide rate in the US, which is a very depressing thought. Again, why?
So that's a great question. So it turns out that there is a neuroinflammatory hypothesis for depression. So the idea is that in depressed patients, there are elevated levels of pro-inflammatory molecules called cytokines. And these inflammation molecules, they think, might be behind some of the mood-altering effects of depression. So basically, in depressed people, you observe these elevated levels of inflammation, and the levels of inflammation also correspond to the level of the depression. So suicidal patients have especially high levels of cytokines in their bloodstream.
Let me
Whereas
stop you though. Suicidal, these are not people who've killed themselves. These people
no,
who
these are people who
diagnosed with suicide.
report being suicidal.
Okay.
Yeah, so I'm sort of summarizing an epidemiological literature on the subject, on specifically the sort of neuroscience of depression. And so basically, there have been these small n studies showing that on days of high air pollution, people also experience increases in cytokines. So air pollution increases basically inflammation in the body, and that inflammation affects mood. And so for people who are already depressed, this could push them into the suicidal range. And potentially, because air pollution is also associated with risky behavior and mistake making and a variety of other types of things, this could be sort of a perfect storm that could push someone into perhaps committing suicide, unfortunately. And so that's why I was sort of interested in the subject, because I think there's suggestive evidence that pollution alters mood, but there hasn't been something that, you know, is a big study that really examines this issue, I think, to my satisfaction until now.
Fascinating. So it pushes people over the edge. Is the effect on suicide attempts, which I realize is hard to measure, bigger or smaller than that on successfully committed suicide? What do you think?
So it's really, really hard to compare estimates because I only have anonymized data on people who, on the number of suicides by county and day in the United States. And so I can't tell if someone has tried to commit suicide, but there is a paper from Vancouver by Siskowitz et al. That does find an increase in emergency department visits for suicide attempts on days of high air pollution. It's hard to, again, compare the point estimates from these different samples. But I also find that on days of higher, when there have been multiple days of higher pollution in the past few weeks, people are also more likely to report that they're depressed, that they have little pleasure in doing things, that they've been diagnosed with depression, and all of these types of things. So it seems like people are seeking care. My guess is there's probably a much larger effect on attempts than completion, but it's sort of hard to know. So I basically find a fairly large effect above the mean. So it's about, 0.5% increase in daily suicides, but that's a 19% increase above the mean of suicides on a given day.
How many suicides per year? I know right now there are about 30,000 a year, as I remember, in the US. Okay. How many extra suicides a year, assuming pollution went up by, say, one standard deviation?
So I didn't calculate that, but I did calculate that a 1 microgram per meter cubed increase leads to about 153 additional suicides a year. So it's not a huge number, but it's, I think, meaningful. And especially when we consider that these are lives that could potentially be saved, and that a 1 microgram per meter cubed increase is not very large, because PM 2.5 actually fluctuates quite a lot. That's only like a 10% increase. And so if you think about the fact that pollution's been falling over time, but suicides have been increasing, these things are actually going in opposite directions. But at the same time, I think still more could be done in terms of, for example, having air purifiers in places that treat suicidal patients in an inpatient or outpatient setting, telling suicidal patients that maybe they should run an air purifier, especially on higher pollution days, or maybe they shouldn't be outdoors exercising, because right now the suggestion is that everybody should go running, and that might actually make things worse. So I think that, my hook for this paper is I think there might be some things that we could do in terms of suggestions for policy to make things better for people who are suffering from depression.
I love the running comment. It sounds like the fight between endorphins and cytokines.
Yeah.
Which
Yeah.
would win? I'm not sure what the answer is. Interesting. Let me move along and talk to Cristobal about his paper, which is slightly different in some ways. In a sense, it asks what the impact is of using a less polluting electricity generation method on respiratory disease. Okay? And he shows that this is true. My question is the effect large enough to really matter? That's the first question.
Thank you for the question, Dan. And usually we economists give you the answer, the simple one that we all hate, which is it depends. So I'm going to give you the honest answer. And just among us for economists, honestly, I don't think it's that large of an effect. We do find an effect that added large-scale solar generation of electricity has an impact on fewer nights at hospital because of respiratory disease, cardiovascular disease, but it's small. Hospital nights are not that expensive. So honestly, it doesn't make a huge difference. But I could easily make the argument on the other side, on the other end, and stretch it if you would like. And I can make an argument that it does make a difference if we believe that this is the tip of the answer. And if we believe that this is a marginal amount of the benefits from reducing air pollution, as per the government's analysis of cost-benefit analysis. So if you allow me to stretch it, I would say yes, it does make a huge difference. But the short answer is no, this is a small effect, what we can actually calculate in our study.
I mean, the real cost, it seems to me, or the benefit from this might be reducing peak load problems. So that if there are more admissions when pollution is high, doing this reduces that peak load, reduces the risk of the problems being encountered in COVID when hospitals were overwhelmed. So would that be an argument, in fact, for going beyond just a simple cost reduction to thinking about avoiding spillovers that cause congestions for other diseases and other illnesses?
Yeah, it is. And it is because oftentimes hospitals are at their peak capacity during the time in which pollution is more prevalent as well. So
Right.
if we can avoid overloading hospitals, that's going to have also an effect that has spillover effects in the healthcare system as well.
So this sounds fine. To me, this is one more benefit of solar. We know solar is becoming competitive with coal-fired or natural gas-fired. How much of the cost differential between solar power and fossil fuel power, what percentage would this offset, do you think, if we really thought about it and priced it in?
Well, it is very hard to elaborate on that with the information I have at this point. However, given the amount of investment that we have observed in this particular area that has a huge solar power potential, we would believe that solar is quite competitive with respect to coal power generation. So the influx of investment in that region is amazingly large and is offsetting rapidly generation of coal by coal generators.
Very good. Now, I wonder if, when publicized your results, that might help lead, especially if you costed out the gain of having solar power through reduced healthcare costs. Wouldn't that be worth publicizing and getting attention to it so the government might subsidize more the installation of solar power generation?
Yes, it is. It's actually, if we move a little bit away from economics into a bit of the politics of this problem, it is gaining a lot of attention in high pollution countries like Chile. The problem of high levels of air pollution, particularly in cities what we call cities of sacrifice, where all polluting industries tend to concentrate, and population there have been suffering from extreme levels of high pollution. So in terms of the political effect and how people are now turning into favoring pro-environment policies and candidates, this is making a difference, I would believe.
You gave me a perfect lead into my next question, which I want to aim to everybody. But since you started, let me ask you first, okay? Are people really catching wise about the impacts of pollution? And if so, maybe the United States is just more backward than a lot of places. If they're getting smart about it, why don't we see more effort to do something about it? I mean, I worry about my grandchildren's eventual health because of the rising heat pollution in the world. So are we making a difference in thinking, or are we just talking to ourselves as economists?
I want to be optimistic. I believe that we are making a difference, a tiny more than has been also contributed by other scientists. And I would dispute the question that we are not doing enough or we are not switching so much. I think that things are changing rapidly over the last years, and we would expect them to continue to change even more rapidly, particularly again in those hubs that have experienced extremely high levels of pollution and they see the government hasn't done enough. Things are turning the other way these days, and there's a lot of pressure by the public to elect officials and to put policy in place that protects their health, basically, because you see on a daily basis nursery schools, primary schools having shut down because of the pollution exposure by toddlers, babies, their teachers, and the public in those cities and towns. They are very, very tired of it. So I think that the tide is shifting, at least in some areas.
It's nice to hear such optimism. Let me try Claudia on this. And let me ask you about a kind of pollution which is not quite the one that Cristobal dealt with, namely the heat pollution and the storm pollution, which are clearly caused by the use of fossil fuels to produce electricity, and which we've seen this very week in much of the US, incredible heat. Texas, where I used to live, the cities had 10 days of 100-degree days already by mid-June, which is phenomenal. And there are floods in places which have just never seen it. So heat pollution, are you worrying about that, or is that too inchoate for us to think about?
So I think there is worry about heat. So there have been some recent papers about heat and learning by Josh Goodman and Jisung Park. There have been some interesting recent papers as well on mortality effects of heat and things like this. The real question is whether the EPA is using these newer economics papers in the sort of cost benefit of some of this stuff. And then, of course, in the United States, there's been a case remanded to the Supreme Court where they're going to decide whether or not the EPA really has jurisdiction to lower carbon emissions overall in general, which could affect the ability of other agencies to regulate chemicals and other types of things. And so I think, at least in the US, I'm a little bit pessimistic about our response to global climate change, but I do have some positive stories on other types of pollution. So I recently testified before the Connecticut State Legislature in support of a bill that lowers the sort of intervention threshold for elevated blood lead levels from 15 micrograms, which was way too high, down to 3, which is now the CDC standard. And I got a nice email that apparently my testimony went over very well, and they did decide to pass the bill, and it was signed into law. And so I do think states are trying to do individual things to curb people's exposure to pollution in general. And then I also did a little bit of free consulting during the pandemic with the State Attorney General's office, who were challenging the EPA's rollback of environmental enforcement, which led to the EPA enforcing environmental laws again. So I have a paper on this suggesting that this sort of soft rollback led to about 8,000 additional deaths from COVID. And so they did respond to this, and my name was actually just besmirched in the media a little bit by Andrew Wheeler.
There's nothing better than having one's name besmirched in the media. It means you did something that somebody cared about, which is not often the case. It's also the case for all the other people here and for anybody else listening, that it is a very rare and incredibly gratifying thing when some specific government policy isn't just talked about, but actually done either directly or pretty close to indirectly because of what you said. So that's a once in a lifetime thing, Claudia. It's not going to happen again, I bet. Let me go on to Ben, who is the only European in the group, because Cristobal's sitting in London. London ain't part of Europe anymore, I'm afraid. So the question is, we have an optimistic view from Latin America, a somewhat pessimistic view from the US. What do you as a European think about these possibilities?
I have to be inevitably somewhere in the middle here in the spectrum of views. No, obviously there has been a huge environmentalist movement in many European countries since at least the 1970s, and you can obviously the public debate comes and goes in waves and has been pushed back a little bit by the Ukraine war and prior to that by COVID, but you can obviously see that the governments in many countries have put in place things like low emission zones and different measures to reduce the amount of pollution, but also to reduce the amount of carbon emissions. So are people on board with this? I would say in most countries, yes. Broadly speaking, yes. The question is then whether when it comes to practical politics on the ground, whether they are actually on board with any concrete changes, such as low emission zones or switching to electric vehicles or reducing the amount of electricity that's produced via coal, for example, which is a big topic in Europe at the moment. So yes, people are on board in general, but there is surely some friction as well.
Great. Let me go on quickly. We haven't got that much time left. For each of you, I've listed other areas where pollution or reduction of pollution might affect things. I listed in my questions to you the child development in utero. I also wanted to know what your thoughts are, going backwards from Ben to Claudia to Cristobal, what your thoughts are about how these increased pollution, or on the other hand, decreased pollution, would affect people differentially by educational category and more generally by income class. Ben, thoughts on that one?
By income class and by educational category. So educational category, we pretty much know that we see negative effects among high-skilled individuals and low-skilled, blue collar and white collar. We've seen enough evidence on that. They may be exposed in different ways. One's indoors, one's potentially outdoors, but there seems to be a general negative effect on productivity. When it comes to income levels, that's obviously a different effect because high income people may have better means of shielding themselves away from air pollution through the type of job they have or the type of place they move to, which may not be available to low-income people. So I would expect that if we find a differential effect, it would be along the lines of income rather than education or occupation.
Rather than ask Claudia that same question, so I've listed a number of things here. Are there any other areas where you think pollution might be causing negative impacts other than the ones I've mentioned, the ones that you all talked about today at the conference?
Yes. So I have a new paper out called Can Pollution Cause Poverty, in which I estimate the effects on gestational exposure to pollution. So exposure while a baby is gestating, on future labor market outcomes, educational attainment, and whether or not a child as an adult is listed on public benefits, in other words, in poverty, and also whether or not they have cognitive disabilities compared to their sibling who is not exposed. So I use toxic release inventory openings and closings, and I look at basically fence line communities that are very close in to these plants that are sort of releasing what we know of as airborne toxics. And I find very large effects on essentially educational attainment. So my primary identification strategy is an instrumental variable strategy in which I use the location and opening and closing dates for the first birth in the family for all of their siblings born in that family. So even if the family moves, I pretend they didn't move, essentially. And so they get the same kind of exposure to try to account for residential sorting. And I find a pretty large increase in the likelihood that a child drops out of high school, a 13 percentage point increase in the likelihood of high school dropout. I find they have about a 1.2 fewer years of education compared to their sibling who lives in the same neighborhood. I also find a pretty sizable increase in the likelihood of having a cognitive disability, meaning, specific learning disabilities, ADHD, autism, these types of things. And then I also find effects on adult public benefits receipt. So they're more likely to be on temporary aid to needy families or food stamps in adulthood. And so the story I'm seeing is consistent with kids getting disabilities from being prenatally exposed during this important time for brain development, and then having a difficult time in school, dropping out, and then needing to be on public benefits. And so, you know, this type of thing I've been talking about as potentially a poverty trap. Because if you are now you can't afford to live the neighborhood, so maybe you have kids there. And there's another paper by Jonathan Colmer and John Voorhees on there being intergenerational transmission of these effects from pollution. And so it's actually kind of a dark story.
Why is it the case when I interview people from 3 different continents, Americans always present the most depressing evidence? I'm not sure why this should be the case. Anyway, let me ask Cristobal if he has any thoughts on this question too.
Well, first of all, I totally agree with Claudia of this possibility of poverty traps in which particularly disadvantaged people find themselves because of exposure to air pollution. And that's concerning, of course, from a social justice perspective, economic perspective. And there's a growing literature on environmental justice that's looking at that. And related to Claudia's studies, like I have a working paper version of a paper that looks at during the week of gestation of an unborn baby, that if the mother is exposed to high levels of pollution, there is a significant added probability that the baby will be born stillbirth, meaning a death, a dead baby, which is, of course, is extremely unfortunate and adds another dimension of the human and economic cost of exposure to air pollution. And so I think, unfortunately, we keep sort of like finding effects almost everywhere we look at. And I think it's about time to probably move on to the next stage in which we look for solutions and test solutions to exposure to air pollution.
This is wonderful. I think this is the first video I've ever done with people at a conference where the bottom line is not more research is needed, as we always say, but rather that we know the answers, let's do something, darn it. So in that sense, this has been probably the most positive one of these video panels I've ever done. I want to thank you all for participating. Thank you for submitting your papers to the conference. It was difficult to get in. I assured I've had probably 4 papers submitted for every one that was accepted. And so the fact that you're on the program is really quite an honor. And it's delightful that you could have been here with me. Thank you all very much.
Thank you, Dan.
Thank you.